Hi, I'm Jean-Marc, the founder of Infinity Alignment Therapy. As I promised on the other video, I'm going to give you today some of the protocol I'm using and recommending to my client to avoid some of the problem like diabetes, infertilities, heart problem, digestive disorder, and like arthritis. I want to tell you a bit more about what is happening to you when you're sleeping, because that is important. As you fall asleep, the body sends a message to your saliva gland to reduce the production. As a result of that, the bacteria and viruses and germs during the day, they're nourishing themselves from the bacteria and the drink you're having. But during the night, because the saliva is reducing, they are to it and they are like a ballroom in your mouth. They are happy, they're jumpy, and they're going to feed themselves from your saliva and the mucus, but they're not going to be washed away and kept in the control by the saliva. A bit like the tide with the sea, right? The tide is going down, and you got all these little animal and crab and all that coming up on the surface of the sun. That's what happened in the mouth. So it's important to clear your mouth in the evening and in the morning, first thing are you getting out of the bed. So I'm going to give you few protocol, you to choose from it what is most convenient and most agreeable to you. Protocol 1, oil pulling. So oil pulling you can find on the internet. There are a lot of information there too. But I always use, and all the product I'm using here are quality product. Quality product equal quality health. So if you budge on your product, you will have a problem with your health. I'm using the coconut oil. It's the first cold press virgin coconut oil. So you use 1 tablespoon of coconut oil, put in your mouth and just move the oil around. Make sure the oil going between your teeth and all the gum, bottom and up, right? You do that for 5-10 minutes. By the time you organize your breakfast or you prepare your child to go for the school and this sort of thing, and after you spit it out. So I have to mention you spit it out because despite I'm mentioning to my client, but somebody come back to me, they said, oh, I cannot carry on with this oil pulling because I feel so sick after that. So I asked, what are you doing? And they said, I'm swallowing everything. And I said, that you cannot digest because you're swallowing all your viruses and all your bacteria, and you're facilitating all these bacteria to move around and to go on a different part of your body and causing chaos. So that's what oil pulling is about. It's about removing all the bacteria and viruses and germs and all that and spit it out in a way they're not going to affect your liver, pancreas, and gallbladder, right? So the other oil I'm using, it's olive oil. So olive oil, this olive oil, it's first cold press, virgin, unfiltered and organic. Maybe a bit more expensive than the other, but again, you find the quality for your health. It's important also to check your teeth when you use olive oil, because the olive oil tend to darken it or make your teeth a bit greenish. That is because the polyphenol content in oil. So if that happens, I recommend you don't panic, just move to coconut oil, because it shows your enamel it's a bit porous. So it lets penetrate the polyphenol into your enamel, and it make a bit your teeth changing color. So don't worry about it. It will disappear after when you stop this protocol. My second recommendation I'm using, and that's what I do most of the time, my children doing that, and most of my clients. But again, it's a personal test. So I'm using hydrogen peroxide. It's a 3% grade, food grade, right? Despite it's only 3%, I always use the top of the bottle, and I mixed half of hydrogen peroxide with half of water, always. If you take the full tap of hydrogen peroxide, your mouth will look like a balloon. The foam will be all over the place, and you cannot do anything with it. So you have to speed it up. So I put that into the glass, and what I do after that, I take my brush and I imprint the brush, and I start to move the brush all around and massaging all my gum and teeth, and brushing the tongue slowly. Always use a toothbrush, very soft blitters and very small head, on the way you got the space around to move it. After that, I drink a bit of hydrogen peroxide mixed with the water, and I move all this hydrogen peroxide mixed with water in my mouth, and move, make the hydrogen peroxide going all in between the teeth, and I spit it out. I don't rinse it, just spit it out. From there, after my next, I take some bicarbonate sodium, and I pour in this little cup, and again I imprint my toothbrush and I massage slowly all the gum, outside, inside, at the bottom, and in, and also a bit on the tongue. When you brush the tongue, be very gentle, because you can damage the fur. So please be gentle, right? When you use the bicarbonate sodium, you just spit it out. Don't rinse it. Just rinse the little corner of the lip, because sometimes some of the crystals stay there and can cause a bit of bleeding and can cause a bit of a pain, right? So make sure you clean this part here. The beauty of this protocol is you really creating a change of pH in the mouth, and you feel so good after that you cannot imagine. So please keep your mouth clean. It's important. One of the clients came to me, a woman in her 30s, and she was very miserable. She tried to conceive, and they tried a lot of things, but nothing was working. So when she came in consultation, I always ask my client to open the mouth, because there is so much here you can see. So I noticed by using the UV light, like some of the picture I posted on the last video, you see all the bacteria around the teeth and on the tongue. And also I did a test to see if it was not connected to an Helicobacter pylori. So for Helicobacter pylori, I use a simple test called Pronto Dry. The Pronto Dry test, you cannot find it in internet. It's only for therapists and medical. So it's very easy to use, and you can always get it from me. It's very easy to use. You use this little spatula, and you put some, you collect some saliva from the tongue around the cheek. You peel this little paper. You put the saliva on a yellow pastille there, right? You close on and you push. By pushing, you impregnated the pastille, and you can see different color on your Pronto Dry test. And it will move, if there's a Helicobacter pylori in your mouth, it will move from yellow to red and red and red, very strong red. So that's what I found on my client. So the first thing we did is obviously clean the mouth, change a bit of nutrition, because the bacteria also, if there's an imbalance of the nutrition level, they will populate, they will love, you know. You will turn your stomach into the 4-star Michelin restaurant. So please don't do that. You know, it's better to the other way, like fast food. They don't like that. Helicobacter pylori is the only one can live in your stomach. This bacteria love the acidity, but it's not the bacteria we want to destroy completely. We want to keep it. It's a very good bacteria also to have it. So as a result of that, 2 months after the consultation, she became pregnant, and she went through the pregnancy without any problem. It's very important for a couple or women that want having a child and become pregnant to have and to use this protocol to have a mouth clean. It's highly important. Why? Because all what we got in the mouth, the flora of the mouth is the same flora than the placenta. So you will, what you have in your mouth, you will contaminate your child, your baby, without knowing. So please keep your mouth clean. It's very, very important. With this in mind, I can't thank you enough for watching my video, and I will see you in the next one